بسم الله الرحمن الرحيم. دكتورة هبة، دكتور إيهاب، دكتورة سحر، الأخوة والأخوات الحضور بمقاماتكم السامية، السلام عليكم ورحمة الله وبركاته. أولا أنا سعيد جدا بأن أكون ممثل لمنظمة الصحة العالمية في مصر، وسعيد جدا بحضور هذا الملتقى المهم جدا، خصوصا من نتحدث عن الانوفيشن، والدكتورة هبة عرفت شو WHO تعني بالانوفيشن، وايضا الهيلث ايكونومي واللي هو مهم جدا، وخصوصا الان مصر قادمة على huge reform agenda in the health system, and it's important really to have health economy part of that. We have seen in COVID-19 and the level and the need for innovation. Without innovation, COVID-19 would not have been really addressed in the same way, despite all the effects and consequences of COVID-19, but really it created the opportunities to use innovation in health system. Innovation is needed actually in all the phases of crisis management, whether we are speaking about mitigation or preparedness الاستعداد، أو الريسبونس الاستجابة، أو recovery المعافاة من emergencies أو crisis. So innovation is needed in all the four phases. الهدف من emergency management is to recognize the potential hazard or potential disaster vulnerabilities, develop strategies, and that effective, that protect the what are the purposes of developing strategies? Really to protect the people, to protect the community, and build their resilience for subsequent crises. It will actually by achieving that, this will minimize the damages that from the crisis and maximize the functionality in the event of an emergency. It's sure, I mean, there is consensus that creating innovative emergency management strategies that incorporate technology will help deploy resources more effectively and make it easier for the people to reach out for the Doctora, she alluded to the innovation during the COVID-19. I will speak from public health perspectives when it comes to the vaccines production, when it comes to the therapeutics, when it comes to the diagnostics. Normally, vaccine production needs and to be licensed, to be used, it needs 5 to 10 years. But during COVID-19, it's only taken 1 year to produce the vaccine without compromising, and the most important, without compromising on the efficacy or safety of the vaccine by using innovative approaches. By the way, before using all these innovative technologies, we have to have innovative thinking before really going into using all these innovative technologies. So without that, despite all the consequences of COVID-19, it would have been much worse without adopting innovative strategies. Usually innovation comes during the crisis, but it should not be like that. Just example, CEPI, which is the coalition of epidemic prevention innovation. And it is coalition of private, public, government, donors, and pharmaceuticals. And it has been established much before the COVID-19 pandemic. And having that coalition during the pandemic was very useful to expedite the production of vaccine, therapeutics, and diagnostic. But many of these innovation has to be open innovation. It's not really restricted or limited to the organization or corporate. It has to be collaboration between the different institution entities to have the impact. And that's why we are using open innovation. We are saying, I mean, WHO is saying that if we speak about the health and economy, that spending on health is an investment and not a cost, because there will be no development without good health. I mean, the whole development cannot be achieved, and SDG will never be achieved, not only health-related SDGs, all other SDGs, without good health and without good community health as well. And the world spends almost 10% of the GDP on health, and in Egypt it's almost around 4.5, but it is increasing. And the trend is increasing, and almost 8% increase every year, considering, I mean, even after adjusting for inflation. And there is reduction in the out-of-pocket expenditure from 62.7 to 59%. So the trend is positive in Egypt. More expenditure or more investment on health and less out-of-pocket in expenditure, which is still high, still very high, and need to be really further reduction. And I'm confident that with the new reform in the health system and with the rollout of the universal health insurance coverage, all this out-of-pocket expenditure will be markedly reduced. However, spending on health doesn't mean that just pouring fund on the health and expecting that we will have good impact. Because WHO also estimates that deficiency losses or wastages account for 20 to 30%, 20 to 40% of the health expenditure. And for sure, with innovation, with digitalization, those inefficiencies will be much reduced. And the yield of any investment will be much higher. So really spending on innovation, spending on, I mean, digitalization, spending on, is cost effective. So what we need from this forum, what we are expecting from this forum, we need really that health economists and economic society to support and guide us and other partners in understanding the sources of inefficiencies in the health system, and actually relevant, because you have listened to Dr. Hiba that they are working across the Arab countries, in Arab countries as well as in those relevant to Egypt. It's really important to know what are the reasons for all these inefficiencies and how we can overcome those inefficiencies. And definitely one of those is by having innovative solutions. I will stop here and thank you very much for the invitation. And really, I'm honored by this invitation. Thank you very much.